Okay, so this lecture we're going to be talking about the patient as a beam emitter, which is chapter 16 in your Carlton book. And the objectives are explain the process of attenuation, describe the basic composition of the human body, describe the effects of the human body on attenuation of the X-ray beam, and explain the relationship of the patient to density/image receptor exposure, contrast, recorded detail, and distortion, so of the image. Really important that you're able to define these in order to do well on your exam. So what is attenuation? It is a reduction in the X-ray photons remaining in the beam after passing through a given thickness of material. So typically when we're talking about a given thickness of material, we're talking about a patient, okay? And it's what is left in the remnant beam once you are done going through your medium, which is the patient. So increased part thickness results in increased attenuation. It is a result of photoelectric absorption, so it provides radiologic significant information. So in order to see the difference between tissues, so there's different tissue compositions. So we go from bone to muscle to fat to air, right? So the bone is going to absorb more photons than fat. So what that does is it gives us the density within the patient. So we're able to see. We rely on that through photoelectric absorption. Okay, so that's where it's given us our information. So we also have Compton scattering, which provides no useful information and contributes to personnel exposure. So the two interactions that happen within the body are photoelectric and Compton. As the KVP goes up, we have more Compton and less photoelectric. So it's the KVP, remember, is the driving force. It's the potential difference. It is the energy of the photons. Okay, so the higher the energy of the photons, the more likely they're going to pass through the air, the fat, the muscle, and the bone. Okay, in order for us to see differential absorption, which is the differences between the tissues, we need to have some photoelectric in there also. Okay, so Compton is the byproduct of a higher KVP, which degrades our images, okay, and it produces your occupational exposure. So the human body as an attenuator, this is your greatest variability. So you need to look at who you're imaging and figure out if they're muscle or if they're fat. So looking here, composition of the human body determines the radiographic appearance. So if we look and we say, okay, number one, you can see this is darker, okay? So the photons are passing through this and exposing your image receptor. So this is air, okay? So it's not attenuating X-rays. The darker the IR means that it is less of a density, so a lower Z number. So your subject contrast, as you can see, this is air in your stomach. Number two, you can see we have a kidney right here. So this has more density to it than the air. And you can see number three is your psoas muscle. So we got muscle there, so you can see it's absorbing some X-rays, and you can see the bone has absorbed the most. It's the most white. So the more dense it is, the less photons that in the remnant beam that are going to expose your IR. So the less dense, the more the photons are going to be able to get through and expose your IR. So looking here, 4 major substances account for variable attenuation. So we have air, fat, muscle, and bone. So with air, the photons are going to pass right through it, and they're going to expose your IR, make it look darker. The fat, it's going to go right through it also. It'll absorb some, but not a lot, and will give you a shade of gray, a darker shade of gray. Where muscle is going to absorb more, it's more compact, has a lot more water in it, and is going to absorb more of the photons, so it's going to give you a lighter gray on your image receptor, whereas bone is going to absorb a lot of them, and it's going to look white as there's very, very few photons getting through to hit your IR. So air, effective atomic number of 7.78 is greater than fat or muscle, so less tissue density, absorbs fewer photons, results in increased area of exposure on the IR. Fat, it's a soft tissue. Effective atomic number and tissue density similar to water, and its effective atomic number is slightly less than muscle, so it's not going to absorb as much as muscle. And the tissue density is less than muscle, so it's not going to absorb as much as muscle. Muscle is a soft tissue, is slightly higher atomic number than tissue than fat, so it's going to absorb more. It's going to give you a lighter shade on your IR. Bone, calcium among the highest atomic number of the elements found in the body, so greatest tissue density of the 4 basic substances that the body is made up of. It absorbs a lot of the photons, so it decreases the area of exposure on the IR. You're going to see white on your IR. So patient's relationship to image quality. So you have density, contrast, detail, and distortion. Density is the image receptor exposure will be altered by changes in the amount or type of tissue being irradiated. And subject contrast is the degree of differential absorption resulting from differing absorption characteristics of tissues in the body. So, subject contrast, difference in X-ray intensity transmitted through various parts of the subject. So it depends on the thickness differences, okay, the density differences. So how thick is it? So is it thin or is it thick? As you can see, this is going to have a photon that's going to pass through it more than the thicker. It's going to absorb more of your photons. Now, if they're packed tighter, so fat compared to muscle, so it's a more dense object, is going to absorb more of your photons. And the atomic number difference. So if you have air versus bone, of course the bone has a higher atomic number and is going to absorb more of your photons. And in order to measure the quality, it's kVp, and we use a half value layer. So, subject contrast, it's a range of characteristics of subjects that influences radiographic contrast. So it is the difference in X-ray intensities transmitted through one part of a subject as compared to the other. So muscle versus bone. The difference in intensity of the beam caused by an object is subject contrast. So the subject, think of the patient, the subject, and the contrast within the patient. Okay, so if you have air and bone like you do with the chest, you have a high contrast image. If you have an abdomen, you have a low contrast image. All the anatomy in the abdomen, the liver, the kidneys, the psoas muscle, the bowel, all pretty much the same density, okay? And that's where we start to play with our kVp, trying to pull out the different densities so that we can see them, okay? So as you can see, more photons transmit with muscle, where bone is going to absorb more of your photons. Okay, looking here at this cool picture. So this is patient thickness or density, and this is your relative exposure. So if we look and we say, okay, we're doing a chest x-ray. So what's going to happen here? With our lungs, right, it's air. So all the photons are going to transmit through, and we're going to have a darker IR. Okay, so our EI number is going to be higher. Okay, our exposure index is going to be higher. So air, the photons pass through and going to expose the IR. And as you can see on this step wedge, as we go through, you can see here in the mediastinum, we are white. So there's a lot of thick tissues, whether it's the heart or the trachea with the thalamus and lymph nodes and everything, it's going to be white. So see how thick this is compared to here? So this is absorbing our photons, therefore giving us white on our exposure. Here's another picture just to give you some other references. So physical contrast within the chest. If you look here, the mediastinum is white. Here's the heart, it's white. The air in the lungs, the photons pass right through. So it's black, whereas the heart, it's white. And there's a mass right there. So, and it's absorbing our photons, okay? So within breast imaging, it's similar to like an abdomen. So think of it that way. So we have a high subject contrast and a low subject contrast within mammography. So a chest is high subject contrast, abdomen or mammography is low subject contrast. So there's not a lot of differences between the tissues. So you can see here we have a little mass right there. So here, image contrast. So this is, now we're talking about the IR. So we have low, optimal, and high. So we can play with our KVP and get these images. So with digital, we have our lookup table. It's going to try to make it look like this. And if we're in film, we wouldn't be able to get away with it. It'd be too contrasty or not contrasty enough. So we would have to set our parameters to make sure that we're at the optimum. Okay, so we want to see all the shades of gray within the chest and mediastinum. All right, here's a slide showing you the difference between a 30 keV and a 100 keV and what's going to happen to your photons. So if we have bone, muscle, and lung, so this is our subject contrast here on this line, and this is our image receptor contrast, okay? So this is our remnant beam, this is our primary beam. So primary beam comes in, and you can see with our low keV, the bone is going to absorb almost all the photons, and it's going to be white. Where muscle, we'll get some coming through. We're going to have shades of gray. Where the lung, most will get through, and it's going to be darker on our image receptor. Where with 100, you can see with bone, more transmitted, so we're going to have a darker shade. Where muscle, a lot more are going to get through, and lung, we have quite a bit coming through. So we're not going to be able to pull out shades of gray if we're not careful. All right. So recorded detail of structures is dependent on position of within the body, body placement in relation to the image receptor. So you want to put the anatomy in which you're imaging as close to the IR as possible. So that's going to give us better detail. Remember we talked about that. So if you have fractured ribs anterior, you're going to shoot the patient PA, correct? So we're going to position the patient so that we can get them as close to the image receptor as possible. So subject distortion. Unless the patient is positioned specifically to demonstrate a particular structure, may not be accurate representation on the IR. So within the patient, remember I showed you umbra and penumbra. So we're going to have a little bit of blurring on the outer edges due to our divergent beam. So the closer it is to the IR, the better. So if you need to shoot a patient PA versus AP to try to get, or oblique, trying to get that position or body part as close as possible to the IR, that's what our goal is, okay, to reduce the subject distortion. We have distortion inherent. There's nothing we can do. The kidneys lie where the kidneys lie, and they're midway in the body. Therefore, you're going to have some distortion. All right, so here's a review. Subject thickness. The thicker the subject, the more the beam is attenuated and the lighter the resultant image. Subject density. The greater the density of a structure within the subject, the greater the attenuation of the X-ray beam. Dense objects, which are strong absorbers, cause the radiographic image to be light and are radiopaque. Subject contrast, influenced largely by the subject's thickness, density, and atomic number. So going along with subject contrast is the visibility of object structure requires physical contrast between the object to be imaged and the surrounding tissues. So we need to see the difference between the kidney and the liver. Now, the one good thing is there's usually a layer of fat around each organ. So you'll see a lucency, so a dark line around the liver, a dark line around the kidney. That's going to help them pop out so that you can see, okay? The contrast may be based on difference in densities or atomic number, chemical composition, coupled with the thickness of a particular material through which radiation has to pass. So it's proportional to the object density times the object thickness. Also remember, high KVP, we have less photoelectric absorption. We have poor contrast due to Compton. Remember that? Compton. All right. that is your lecture on your patient as a beam emitter. Really important that you understand the difference between your subject contrast, which is your patient, and your image receptor contrast, which is what is the resultant on your image receptor.